I also want to know, Jason, when you counsel men who are diagnosed with prostate cancer, the discussion of sexuality is oftentimes the elephant in the room. A lot of times nobody wants to talk about it, or the issue is not even broached. So how do you oftentimes broach the discussion, and how do you create one of those active listening type dialogues where you can have a really good conversation? And is the spouse usually there, or the significant other, or do you try and do it alone, or do you have a special session with the patient and their partner in the room?
Sure. Yeah. So, I mean, I think first of all, I'd say that it really is, to your point, sometimes the discussion around sexual function and possible dysfunction after prostate cancer is often overlooked because rightfully so, the man is concerned about the fact that he has cancer, and his laser focus is on how do I treat this and how do I cure it. And so then oftentimes I'll end up seeing a man after the fact and they say, okay, I'm through that. Now what can I do? And of course, I always say, well, it'd be great if we could try to talk about these things before surgery. And when I do have that opportunity with men, I do tend to tell people that while not all men will end up with sexual dysfunction, I often kind of ask them to, prepare for the worst and hope for the best, just because it is oftentimes something that we have to deal with after the fact. The inclusion of a spouse or significant other in the conversation, I think, is very, very important. And I think in a lot of ways, I'll kind of contradict myself and say sometimes it's the most important thing and sometimes it's not so important. And by that, I mean, certainly sexual practices, two people oftentimes are involved, and that spouse, your goals, for sexual restoration, sexual practices, what their sort of interest is definitely plays a role. But at the same time, sexual function and potential restoration of that function is a very important thing for a lot of men in terms of how they see themselves, for their self-esteem. And a lot of guys tell me, I just want to feel like a man again. So I've treated many men in whom are not actually currently sexually active with their wife or another partner, but they're interested in these therapies so that they have the confidence to be able to pursue that if and when they might choose to do so. But anytime a man is in a relationship with a partner they trust, I always invite them in for the conversation, because oftentimes the man is there and has great questions, and other times he's kind of sitting in the corner and his wife might be asking all the questions that he wants to ask but may not quite be there. So I try to create a safe environment, inclusive environment, and also let them know that, hey, I know that you're not used to talking about this stuff, but I assure you that there are many, many guys just like you that are going through it. And sometimes it takes a few visits to really get through it fully, but we can always get there with them eventually.
Thank you.